Hey guys, long time no post. I apologize for my absence the last couple of weeks. I had the worst cold I've had in about 10 years, and yeah, making videos just wasn't on the agenda. So this morning I thought I'd go ahead and check in. I had an appointment with my primary care physician yesterday, and when they took my weight, it looks like I'm down about 20 pounds from the same time last year. So I was feeling pretty good about that, which means that this physician supervised weight loss diet, I'm doing okay. I could do better, but yeah. Today I am at my psychological evaluation appointment with Dr. Stote here in Carmel, Indiana. And I really don't know for sure what to expect. I've watched other videos and done some reading, so I kind of have an idea based on what other people have said, but I've also found that everybody's experience is a little bit different. Every doctor does things slightly differently. I think the end goal is the same among the physicians, but we'll see how this goes. I'll check back in once I'm out of there, and I'll let everybody know, in general what transpired, so that those of you who are kind of apprehensive and worried about this, first of all, I'm really not nervous. I would rather be getting real work done rather than spending 2 hours in a psychologist's office, but outside of that, this is normal. If the insurance company didn't require it, my physician was going to require it anyway. So, and it makes sense. It's all part of these groups of physicians that do these bariatric surgeries. They want to keep their statistics up in a positive way. They don't want to lose patients, on the surgery table. They want patients to be successful with the weight loss, get it off, and keep it off as best they can. And screening patients who will not do well with this surgery and finding alternatives for them will help their numbers, and it's better for the patient too. If they really believe you're not fit at this point to have this surgery, you probably ought to take notice and find some other ways to deal with the issue. But I got about 15 minutes, so I'm going to walk on up and I'll get back with you guys later. Okay, well, I'm back from my psychological evaluation with Dr. Stote, and guys, there's nothing to be worried about. It's very standard fare. When I got in there, the receptionist handed me the typical clipboard with all the paperwork on it. There was a survey in there that I've taken before about anxiety, to detect your level of anxiety. There was 3 or 4 pages of, where you rank various statements as yes, or applies, or strongly doesn't apply, or whatever. There were a lot of questions in there about eating habits and why you think, why I think I'm overweight, what caused my weight, and I answered them honestly. Once I turned that in, I was in the waiting room maybe 10 or 15 minutes. I assume the doctor was probably reviewing what I had filled out. Then I went back, and for about an hour we just had a nice conversation up front. He told me what he was going to ask about, just to kind of prepare my thinking, and a lot of talk about my family history and my habits now. We talked a lot about my childhood, high school, how my weight has changed over time, and what I think my biggest stressors are. Nothing embarrassing, nothing that I thought a doctor would want to know. And at the end, he basically said he didn't see anything in the interview with me that would preclude me from having the surgery. So at this point, I guess it's a go. The one thing about him, though, is maybe you'll run into this too, so be prepared. The fee was $120, and he does not file with insurance, so because he's not a Medicare or Medicaid provider. So I do have a receipt. I'm hoping I can file with my insurance company and at least get a little bit back. But that's not a big deal. I'm not going to lose sleep over that. I am glad I got this milestone out of the way. I've checked the box, and he was helpful in making me feel more comfortable in opening up by telling me what he typically hears as the most common responses to things like, what are the biggest stressors in my life right now? And he said the most common one is financial stress, which as Americans, I think most of us experience that from time to time. And you can only do Dave Ramsey so much before you start to go crazy. But yeah, I think this was a good appointment to go to. Not a waste of time at all. And like I said in the introduction earlier, it definitely helps them find patients who may not do well. Because he did ask me a little bit about what I thought things would be like after, a year and a half or 2 years out from surgery, because he said, that honeymoon period for most people is about a year, and he said you will lose a lot of weight because you really don't have a choice, especially as a man. Obviously I'm going to have an easier time than a lot of women will with the amount of weight loss. But he said typically people start to rebound after that as your body adjusts and your sleeve or your pouch or whatever you have, expands a little bit. You start to allow other food choices to creep back in. So, yeah, that's in my mind that's been the psychological struggle since I started this 6-month supervised diet, is worrying a little bit about, because I know myself, and if we're all honest with ourselves, we're all going to struggle a little bit at least. As time goes by, you're going to get used to things. You're going to be out with friends and family wanting to do stuff, and as a culture, and this isn't just an American thing, this is elsewhere in the world too, food is at the center of celebrations, of our social lives. So that's something I'm working on. So I will go ahead and wrap this up. If you like this channel and you want to continue to follow my journey, please like this video and subscribe. I'm going to attempt to do at least a weekly post from here on out, but we'll see how it goes. And I thank you for watching, and hopefully this was at least a little bit informative and helpful for you. Yeah, otherwise, we'll talk again soon. Thank you.